Hi everybody, this is Dr. Moises Salama, I lead plastic surgery. Today I'm going to talk a little bit about vaginoplasties. Vaginoplasty is a common procedure that patients inquire about. It's changing the shape of the vagina. The vagina, as illustrated in this model, is basically like a tube, okay? Vaginoplasty is kind of a generic term. It's just changing the shape of the vagina. What we do most commonly is called posterior colporrhaphy. We're going to narrow the canal, the vaginal canal, and a perineoplasty, where we narrow the introitus or the opening of the vagina. Okay, so this is our model. This is the opening of the vagina, the labia minora, the labia majora, and this is the perineum. When I start off, I'm basically gonna access the posterior wall, would be the back wall of the vagina, which is right above the rectal wall. I'm going to isolate some of the pelvic floor muscles, namely the levator ani, and I'm going to bring those muscles together with posterior sutures inside the vagina. And it's almost like doing a tummy tuck, but inside the vagina to narrow the lumen. And I'm going to put several stitches to make the lumen smaller, okay, so that with intercourse, there's more friction to the area. Because most women, when they come see me for this procedure, it's because they've had multiple children and they just feel loose down there. So that's very important for the woman to narrow the size of the lumen. But also we're going to narrow the opening. Okay, so basically this is called the posterior fourchette, and this is the vaginal opening. We're going to make this smaller also for the same function. So in this area, we're going to remove a little bit of the posterior aspect of the labia minora, and we're going to bring these muscles together, which are called the transverse perineal muscles. Okay, because we can't just remove skin and mucosa. That's not going to last. You have to bring the muscles together in order to create a tighter effect. Okay, so that's essentially what a vaginoplasty is. So it's basically a perineoplasty, making the opening smaller to the vagina, and also the posterior colporrhaphy, making the vaginal tube smaller.